Hi, I'm Ron Roel, host of 45 Forward. In today's conversation, I'm talking with Mark Wilson, the author of a terrific new book, Breakthrough Alzheimer's Care, a guide to finding courage, longevity, and joy on the journey. Now, having written extensively myself about family caregiving, I'm always interested in new perspectives on caregiving. So I'm delighted to have Mark on the show today because he offers a truly refreshing and unique approach. It's important for a couple of reasons. First, because providing care for loved ones with Alzheimer's is among the most difficult challenges a caregiver face, as I did with my mom. People really need help. Second, as you'll see, Mark's approach makes use of his long experience as a senior manager in the business world in creating a practical, accessible model that breaks down caregiving into 5 breakthrough pillars. And what Mark does, besides offering a lot of useful tips and tools we can apply broadly to caregiving, he helps us transform ourselves from being caregivers to becoming care leaders. I found this to be truly breakthrough mindset. So without further ado, let's learn all about it from today's guest, Mark Wilson. Mark, welcome to the show.
Well, thank you, Ron. I'm so excited to be part of your experience here. I couldn't be happier to be on your show. So thank you so much.
So let's just start with a brief intro. We have a lot to talk about. And people can read about your life in the book, about how you did the book. But just give us a little bit of a background about how it is that you came to write the book.
Yeah, well, it's interesting because I was a senior leader, kind of an executive at Taco Bell, leading leadership development, training, recognition programs, talent development, and so I loved it. It was a great career. It was very fun. But then my mom was diagnosed with Alzheimer's, and kind of midway through my career, and my mom was just such an amazing person. She helped me so much, helped my sister, and to me, it was like, okay, I want to take care of her at home because I knew I could control the environment better, and a number of things. My mom basically, I didn't know anything about the disease, and then she got the diagnosis. I pulled the neurologist aside and I said, "Well, I don't know anything about that. How long does my mom have?" And she said, "Well, she has Alzheimer's, vascular dementia from our diagnosis, and then also some comorbidities around heart disease." Anyway, she said, "Maybe 5 years." And I thought to myself, early 70s, that doesn't work for me. I want her to live a lot longer than that. So I thought at home I could at least, I didn't know what I was going to do. I didn't know how I was going to help do that, but I knew I could at least try it. So I thought at home I could probably have more impact. And anyway, so I went to my boss. I said, "I'm sorry, I've got to leave the workplace to take care of my mom." He thought I'd lost my mind because he said, "You're not even old enough for early retirement. What are you doing?" So you got a great career. I said, "No, this is a priority." So I left and took care of my mom. And I'm so glad I did. My perspective was, I thought, I knew there was no cure for the disease, but I thought, okay, I knew there was lots of things from my reading and talking to experts, little things that can be done that don't cure it, but can make a little bit of a positive difference. And I thought, if there's some evidence, I know it's not like FDA approved stuff, but if there's some evidence of something changing that could help her, why not? And my mom and I were always really, really close. And so she trusted me to do all these crazy things. So I said, okay, let's just throw the kitchen sink at the problem, everything. And it worked. She ended up living very happy at home. She was very happy, and she lived more than 3 times longer than 5 years, and she may have even lived longer, but for a medical mistake later in her Alzheimer's. We get to that if you want, but it's kind of another whole story. So she could have even lived longer. And anyway, so I'm so happy that I tried all these things, and then I have being a leadership development kind of expert, I applied a lot of leadership in HR to my care because many of you know, I tried to do it myself for a couple of years, and then it got too hard. So I needed some home care help. And thankfully, I had long-term care insurance from my mom, and that helped quite a bit. Anyway, so a lot of the book is kind of a combination of all these crazy tactics that ended up working, and how I applied leadership in HR to the care leadership experience. So.
That's great. Yeah, yeah, and it works. The book works too. So you talk there. There are 5 breakthrough care pillars. But before we get to those five,
Yeah.
you've got what I call the core four, which is
Okay.
shifts in mindset, which I found important as well. And as you mentioned, they're all sort of based on the love for your loved one. But I just want to run through them quickly first because I
Yeah.
think they're good. So the first shift is a shift in attitude. Okay, from I have to I get to be my loved one's care leader. So it gets you into a different kind of mindset. I think that's really different because a lot
Yeah.
of us think about, well, we got to manage this. It's a burden. Like, oh my God. And so explain what this shift means.
Well, the shift, all these shifts are really important because, I discovered that to be an effective care leader, you have to have the mindset and the strength and courage to be a leader. Now I also lead a number of support groups for the Alzheimer's Association. And these people come in to the meetings, they're crying, they don't know what to do. They're all feeling like victims. And so the mindset shift is important. So instead of thinking it is a burden to take care of your loved one, but if you kind of get mired in that, you're going to get lost and you're not going to be very effective and you're not going to be happy. So, try to have the mindset shift to say, okay, yeah, it's a hard thing, but it's a privilege too, because I get to try to make a difference. And you can, if you kind of follow some of these ideas, you can make a big difference in your loved one's life. So that's an important mindset to kind of forget, it is a burden, but don't look at it as a burden. Look at it as a privilege and an opportunity.
Yeah, yeah. It's worked like a lot of things, but so I like the language though. So that from I have to I get to, because this reminds me of I listened to a webinar with a guy named Marcus Engel who wrote a book called I'm Here, and it was about his experience as a patient after a horrific accident that really just almost killed him. And he describes even when he was sort of waking up from the accident and learning who his caregiver was. It was this nurse, and he said the impression, the biggest impression on him was when she said to him, I get to take care of you. It was this, he said, that's the definition of compassion. I get to take care of you. Not like, okay, here I am, I'll take care of you.
Right.
So it makes a big difference from the patient's point of view, even if you don't think about it. Yeah. So that's a really important first one. So the second one goes to your care leading pillar, which is second. I'm shifting from I am assisting my loved one to I am an accountable leader for all aspects of my loved one's care.
Yeah, that's leader. I know about leadership, and great leaders of all time, they're accountable and they make things happen. And so this is similar. That okay, you can't just kind of like the image of the cat just kind of barely hanging on. You've seen that poster. No, you have to not only you're not just assisting in caregiving, that's important, but you have to be a care leader to really make the biggest impact. And you're not an expert at everything. I mean, your loved one probably needs some direct care. They need doctors. They need physical therapy, whatever it is. But you don't have to be an expert at everything. But you know enough about these different things to be a leader of that. I mean, I had a staff that were far more expert than I was in a number of things, but I knew enough, and I felt accountable for the results that I directed and coached experts in various fields. And you kind of have the same role as a care leader. You're the master plan leader, and you create the actions, and you decide what's going to be exposed to your loved one. How do you do it? What are you going to do and not do? And then you lead those experts that bring in the pieces of your plan. And so that's kind of the idea. So,
And I think people sometimes, not with the intentionality that you show, but especially when the your loved one ends up in a facility or some hospital or something, and you realize I can't just let go. I need to take charge of this. So I think that's the attitude all the way through it. I think that's really important. So the third one is you mentioned is especially with Alzheimer's. Okay, but how can this disease be happening to me and my loved one? Shifting that to, as you mentioned in the beginning, how can I make the biggest difference in the life of my loved one?
yeah, it's an interesting. That's kind of victim to leader. It's easy to become a victim. It's like, okay, this disease has changed my whole life. It's changed the life of my loved one. Why is this happening to me? And if you get caught up in that victim mindset, you're not going to be good for yourself or your loved one. And I learned there's a couple of tools that I share in the book. One is called the mood elevator, and it's John O'Keefe is a leader in leadership development. He taught all the executives and leaders at Taco Bell and the Yum brands these concepts. So mood elevator, if you're low on the mood elevator, and the low on the mood elevator are things like you feel like a victim. Why is this happening to me? I have no control. Then you're not going to be an effective leader. So I knew from that teaching that you got to kind of get that out of that mindset and into, okay, I can make a huge difference for my loved one. Um, and to have that mindset is very important, and not to be wallowing in the victim, because it's easy to do that because it is a horrific disease. But you got to kind of shake yourself out of that mindset and start thinking, okay, yeah, but there is a plan. I have ideas. I know what I can do to help. I'm going to focus on that rather than the fact that this horrible disease is happening to me and my loved one.
Yeah. Yeah, it reminded me too of I did a podcast with a guy named Hank Bjorklund, who was actually he was a successful lawyer, but before that he was a successful running back with the New York Jets football team. But after he retired, he found himself suffering from a mysterious autonomic disruption of his autonomic nervous system, and he didn't know what the hell was happening, and it was really horrible for him. And I think he eventually coped with it. But then he said to me at one point, I thought to myself, stop saying. I never wake up saying why me. I wake up saying why not me. And that's the thing. It's like, so there is a grieving process about, gee, some of this really sucks. But, as you said, being a victim doesn't help anybody. So okay, so on to the fourth shift, which you've alluded to, but I don't know much about Alzheimer's or Alzheimer's care, but shifting to no one knows more about my loved one, and I can learn everything I need to know.
Yeah, that's really another important one, because it's easy to say, and I had that inkling when my mom was diagnosed. It's like, whoa, what am I going to do? I don't know anything about caregiving. I don't know anything about Alzheimer's, but I know about my mom, and I know how important she is to me, to the world. And I would lead training and development for Taco Bell forever, and so I know about learning. And many of your listeners are probably excellent learners, and you can learn everything you need to learn about caregiving and medical care and all these. Again, you don't have to be the expert. You just have to know enough to lead the care. So, for example, I mentioned in the book, I have various tools and sources that you can learn about your mom or your loved one's medical condition. There's amazing resources out there, websites from, Cleveland Clinic, Harvard, all places. Whatever your mom or loved one has, you can learn about enough to have good conversations with your doctor, to make good decisions for your loved one. You're not a doctor, but you know enough where you can be informed. And same with caregiving. I mean, I didn't know anything about caregiving, and when I interviewed caregivers, I made some mistakes the first couple months, and I, fired those that weren't amazing. And then after a while, I really learned a lot. And so I was really clear on my expectations. I communicated with them. I was really clear on the selection criteria, because I became knowledgeable enough to know what I was looking for, and when I had it, when I didn't have it. And so that's the idea, that you're going to apply your knowledge of your loved one and learn these other things. It's very learnable if you just kind of watch, observe, read, talk to people. You can learn everything you need to know. You don't have to be an expert at any of these things, but just enough to be the leader of them, if that makes sense.
Yeah, sure. So I took these four, and before going on to the five, Mark, I compressed them into three, which I call the three L's.
I like that one.
Love, learn, and lead.
Oh, that's really good, Ron. I like it. I may borrow that. Love,
Absolutely.
learn, and lead. That's good.
Absolutely.
It's true. It comes from love. I mean, and you talk about your loved one, and love is leadership and learning. You put in the effort to be a leader, to learn. And yeah, it's some sacrifice. But if you think about it, what is love? Love is about sacrifice. I mean, if love is easy and, it's really, I mean, it may be love, but it's really tested when you're willing to give up yourself, give up something important for your loved one.
Yeah. Yeah, I think there are lots of studies that show that the degree of love is directly proportional to the amount of sacrifice that's
Yes,
required.
absolutely.
Yeah.
Yeah.
So yeah. So let's go into the five. And before we actually go into them, you talk about their breakthrough pillars, and everyone talks about sort of colloquially breakthrough, but you have
Yeah.
a very specific idea of what it means to be breakthrough. So talk about that first.
Yeah. No, it actually comes from a program that, again, we taught all the leaders at Taco Bell and the other Yum brand companies called Breakthrough Leadership. And breakthrough, by definition, at least experts' definition, is results that are greater than 50% improvement. So if you make little improvements, those are good. Um, but breakthrough is 50% or more of an improvement. And so when I was reflecting on my book and writing it, I thought, okay, my mom lived more than 3 times longer than they thought. That's more than 50%. That's 300%. So must be breakthrough. So that's the umbrella reason why I even have the book title, because the results are breakthrough, and therefore the tactics that lead to breakthrough are breakthrough pillars. So,
Yeah, and I know there are obstacles to this, and you talk about a number of that and those as well. One of them that I find difficult sometimes is time. People say, "Well, I don't have the time." So just talk about, and there are more that people could look at in the book, but let's use that as an example.
sure, yeah, time is important, but you know, I used to teach time management early in my career to managers, supervisors. I mean, the fundamental concept of time management is decide on your priorities. And I've even taught, like, okay, your highest priority activities are your A activities, and then you have like A1, A2, A3. So to me, taking care of my mom, clearly, I mean, the fact that I gave up my successful executive career put her on the A category immediately. So so she became my top priority, and we have time for our top priorities. And so you just have to kind of make your loved one's care a high priority if you can, and then you can manage the other tasks. And I mean, some of these tasks you have to do; they're not the highest priority, and then those you try to delegate. That's kind of the idea. I mean, if you can find neighbors, friends, family that can do some of the things that need to get done, but may not be the highest priority, but you, as the leader of your loved one's care, need to focus your attention on the A priorities, which is your loved one's care. That was my mindset, and hopefully others as well.
Right. Great. Okay, so let's go on to the five. So I'm going to just list them quickly and then get into them in more in depth.
Okay.
So the first one is self-care. Second one is safety. Third pillar is building the finest care team. Four is using powerful brain-body nutrition and medications. And five is creating powerfully positive and stimulating surround sound, as you call it, every day. So I just want to go through quickly, and then we'll go through them one by one now. So self-care, that's
Yeah,
something
self
people talk
care.
about a lot.
Yeah. Well, if you think about it, if you're going to be the care leader, if you don't take care of yourself and draw on this I talk about internal sources of strength for a caregiver and external sources, and those are the two ways you can be a strong, confident, healthy care leader. And if you don't have the right powerful mindset, if you're not healthy, if you're not taking care of yourself, you're not going to lead anything. so, so that's like number one. The foundation is you. I mean, you're the most important person in this formula, and so you got to take care of yourself. And I talk a lot about the tactics to do that in the book.
Okay. Okay, pillar two, safety.
Yeah, safety to me is like, again, a little bit like number one, common sense. Because if your loved one isn't safe, then they're not going to live longer, and they're certainly not going to be happy if they're hurt or sick or whatever. So safety is really important. It's like a foundation element. It's like, okay, you got a nice car, but the wheels aren't on there. There's nothing good's going to happen to the driving. So it's kind of like that. So and in the book, I talk a lot about, okay, I was at home, but safety is important whether you're in a facility or at home. So, and creating a safe environment in your home is not that expensive. It's pretty inexpensive. And I talk about some of the things that are critical for home safety. And then I provide a checklist of all the safety implications for you in a facility. It's like, okay, if I'm going to evaluate a facility, safety is pretty important. So go in with that checklist there. Are they doing this? Are they doing that? And so you've got a nice, way to evaluate a facility for safety, because it's important whether you're at home or in a facility. So,
Right. Yeah, and I think it's important, as you say, being a care leader, you don't relinquish your responsibility if someone's in a facility. You're still in charge, and so you have to sort of make sure, continue to advocate for them, watch out for them. And you can look in the book, and Mark talks about, I mean, obviously the three main areas are the bedroom, the bathroom, the kitchen. But so you can look, the book has some good checklists to look at. And I guess also, now that, we look at, actually COVID, brought us through this, but one of the things in terms of safety is thinking about the infection controls in facilities. That's another thing to really check for.
big time.
Yeah, yeah. Okay, pillar 3. Building and leading the finest care team for your loved one.
Yeah, that's, to me, in the book. If you get the book, you'll see that's the biggest, kind of chapter area, because the leadership, the team is so important. I mean, you're only as good as your team, and I don't even know how some people take care of their loved one by themselves the whole journey. I couldn't do it. I needed a team. And I think a team is very helpful for you. It's helpful for your loved one if you pick the right team. And so, there's a number of aspects to that. So I break it up into two teams. I had a direct team, which are the hands-on caregivers that help with bathing, eating, all the kind of direct things. And then there's extended team, and those are doctors. I also had physical therapy come to the house every week, because I knew from my reading that mobility is both critical for fun. I mean, if you're bedridden, you're not going to have any fun, and it's also critical for health. And I had some speech therapy come in. I found out you could bring a dentist into the house, a doctor. I mean, anything you need can be done mobile, whether you're in a facility or at home. And that's important, because dementia patients, it's very difficult to get them out to doctors and so forth. So that's the extended team. And so the critical aspects of both teams are selection. So in the book, I have a whole interview protocol about how do you interview a caregiver, what do you look for, what are the questions to ask, what are the answers you're looking for, and then how to evaluate them on a trial shift. Because it was so funny, because the agencies I worked with agencies, because I was fortunate enough to have long-term care insurance, and they required that I work through an agency for coverage. So they were so funny. I call one up, and they would just say, "Okay, we'll send you somebody." So no, 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 no. You don't send me anybody. I'm going to interview them at a Starbucks first. They said, "Really?" I said, "Yeah." And so they would send me. Well, the other thing too, as a leader of talent, I knew that the talent pool, the more people you had to choose from, the better your talent. So I didn't use this one agencies, which people like, "Really? You had a lot?" I had like 5 different agencies that I targeted, and I was, tell me, give me your best candidate or two. I'll interview them, and then I had a better talent because I had more to choose from. And so then I picked these amazing caregivers. I made a couple mistakes I talk about in the book. In fact, I learned when to fire a caregiver immediately. There were a couple of cases where they just did really, dumb things. One fell asleep on the job, and my mom, sort of fell. She was okay. And then another one, had a little drug use, and I, fired, go home. It's like, I don't need, I don't need drug use. Take care of my low. Another one was on the phone all the time. My mom was trying to get their attention to have fun and play, but they were like ignoring her on the phone. I saw that. I said, go home. Right, so anyway, so I learned a lot in the beginning, but then I found the 5 best caregivers on the planet, and they stayed with us. The agency paid them whatever the average rate is, but they stayed with us for 6, 7 years, zero turnover. And it was because they knew their mission. Their mission was to help me help my mom live longer and happier. They loved being part of that mission. And they were the vehicles that I administered all these ideas, from nutrition to therapies to all this kind of stuff. And they were my partners, and they loved it. And they were terrific. They showed so much safety, love, caring, fun with my mom. A big creativity. They were tuned into her health. They were just remarkable. And my sister and I are still friends with all of them. We have fun with them. We celebrate things. So, and then the extended care team, I talk about a lot of people think, especially doctors do not like to be managed and led. they think you work for them when in fact they work for you as a care leader, but they don't think of them. So I have a lot of different tools and techniques in the book about questions to ask them. A list of questions are in there for dementia patients. Um, and the one concept is I learned this because my mom had uh, before she actually got Alzheimer's, she had a condition that these doctors in the Orange County area just were not gurus enough to diagnose it and solve it. And my mom went to all these different specialists, and it was just too hard. And if she had dementia at the time, just wouldn't have not have worked. So I talk about doctors and other specialists being like any other worker. There's poor doctors, there's average doctors, there's good doctors, and there are gurus. And sometimes we think of doctors because they have a medical license as they're all good. They're not. so, so I had to find a guru to help my mom's condition, and I did that um, in a really creative way because she went to like 10 different doctors and they didn't solve it. And so I found out that their condition she had was vulvodynia, which is basically means unexplained vulvar pain. And so I found out that there's a National Vulvodynia Association. Who knew? So, and I called them. I said, "Well, I need to know. I need a membership list." Anyway, I had to pay like a $50 membership fee, and they sent me this list. And I found a guru only about an hour and a half from our house, and he solved it in one visit. He solved pain that she had been having for 2 years that nobody knew how to do it. But because he taught on it, he did research on it. He was a guru. He solved it. So sometimes you need a guru for your loved one because they won't have the patience and ability to go to multiple doctors if they're in the middle of a dementia. And so anyway, I got a lot of little things about doctors and how do you lead them and when to fire them and and other specialists on the extended care team. So all that's all on pillar number three. So,
Yeah. Well, I think it is a long chapter, but it's worth it because it takes. I think people think about these things kind of you know, in an unsystematic way, and I think your background, in corporate management, really taught you a very systematic way to approach it and evaluate it, and get rid of people when you have to. But one of the expressions you use was from your grandmother about you took care of her too, and the expression was don't settle for shoemakers, right?
yeah, so funny. But yeah, my grandparents were born in Sicily on my mom's side, and so she didn't have Alzheimer's dementia. She lived to like 96, and she and I were very very close. I mean, she was a big influence on my development. Anyway, so she had later in her early 90s, she had a form of leukemia, and so we had to take her for some infusions, and so she would sit with me at the waiting. I would wait for her with her, and she'd look at me. She'd say, uh, "Don't let me go to that shoemaker over there," because he was like he would jab her like multiple times before he figured out. And a shoemaker in Sicily was like a what that meant was that they didn't know what they're doing. Or we're just not good. And I look at her, go, okay, we called her nanny. Nanny, I won't let him take care of you. So I did. I insisted, no, no, we're not going to him. Find somebody else over here. so, and so, the experience was much better. But yeah, the shoemaker was funny. Yeah, exactly. I say any shoemakers are reading this book, I apologize.
Yeah, well, but if you're a really good shoemaker, know how to make good shoes. That's different. Yeah, but
Exactly. You're right.
it's an expression. Okay.
Yes.
Okay. So pillar four, use powerful brain body enhancing nutrition and medications.
Yeah, it's so funny because as I was reading about the disease, I learned that good nutrition is a longevity factor, and people know it as avoiding dementia and living longer. But I did find some research that indicated that good nutrition can not only prevent dementia, but can help you live longer with it. And so I told completely changed your diet from, processed foods and meats and things that we normally eat to all healthy, the whole all healthy Mediterranean-like diet, dash diet, whatever you call it. And so she went along with it. And it was also not only was it better from a health and longevity standpoint, but it was safer to eat because dementia patients can't eat big chunks of meat. So anyway, it worked out. It was like a win-win. And then on the supplements, it's so funny because, we know doctors hate supplements. In fact, as a side note, I asked a number of leading neurologists and doctors, for endorsements of my book, and they all said the same thing. Said, "I love your book, best book ever, but I can't endorse it because you talk about supplements." And then I said, "Okay, what if I put a little disclaimer on that page about supplements?" So I did. So I got their endorsements. They don't like supplements, but it's funny because there's many supplements that have quote unquote some evidence that they help, and in my strategy of the lots of little things adding up to a big difference, I thought, okay, let me try these supplements. So I was careful. I tried them in very small dosage, make sure my mom didn't have any side effects, or some medication supplements have side effects. So if she was able to tolerate it, I thought, okay, I'll give it to her. So I had bunches of these different supplements, and I don't know what caused what. I don't care because it helped her. So cumulatively, they all helped. And so I had supplements, and then of course, prescription medications that are at the time. Now there's new medications that help a lot. So ask your neurologist and doctor about the new things. There's a number of new things on the market which weren't in the case when my mom had it, 10 years ago, say. So yeah.
Right. Yeah. But yeah, so stay on top of it. Things change, and
Yep. Yep.
I think in my mom's case, we had to sort of decide later on, like, okay, at this point, she doesn't. These medications aren't really helping.
Yep.
So you really focusing on what really helps. Yeah.
Right.
Okay. Last pillar: create powerfully stimulating surround sound. Sorry.
Yeah, this is a funny one because it kind of had its root in a project I did at Taco Bell many years ago. I was working with a senior marketing leader, and the CEO gave us 13 pilot restaurants in Tucson, Arizona. And I basically said, you guys do whatever you want on the people side, on the marketing side, on the architecture side, and we'll see what we learn for the whole system. Because Taco Bell has 6,000 restaurants, so we had 13 sort of play restaurants. So we did a lot of kind of crazy, fun, experimental things. But I brought in a consultant to talk about the customer experience, and he taught us that there was a concept called touch points. So the idea is that when a customer comes into any retail kind of place, they have experiences, and that's including smelling, seeing, feeling, and emotional and tactile. And anyway, so I kind of borrowed that concept. I thought, okay, my mom's life, each hour, each day, each week, is a series of touch points. And those touch points can either make her safer or more dangerous, more fun, more loving, or opposite of that. Not fun and not loving and boring and whatever. So I thought, okay, I'm going to create a surround sound for my mom of touch points that are positive, hopeful, loving, caring, fun, and safe. And so that's the way I kind of looked at her day, week, month, and I realized that they came in two categories. One is the physical environment. So we tried to create everything. My mom was a kindergarten teacher for her whole career, her whole life really, and she loved kids and she loved all the fun things of the holidays and festives and you know stuffed animals and pictures and all the things that kindergartners love. So we created that in the house, and she had all kinds of fun stuffed animals on her bed. We would take her out on an adventure every day. I thought that was important both for her health and movement. And we'd either bring a wheel, depends on the look where we went. We either have her in a walker, or if it was longer or more difficult terrain, in a wheelchair. But we would decorate either the wheelchair or the walker with stuffed animals and tie them on there and pictures and stuff. And my mom lost her speech. One of the first things that went was her speech. But but she was still there, personality wise, for 99% of the journey. And so we would take her out, and these kids would come up to her wheelchair or walker, and they would just beam with stuffed animals and fun things. They go, "Oh, look, Mom, look, can I touch it?" And then we say, "Yeah, sure." And so, but my mom would be so happy to see these kids so excited about the things that were on her wheelchair or walker. And so that's an example of creating a physical environment that's loving and caring and fun. And everybody's different. So for other people, it may not be a kindergarten, fun, children kind of environment, but it might be something else. So that's a physical environment of surround sound or touch points. And the people environment is similar. So my goal was to make, every moment of every day fun, loving, caring, compassionate. So all the people that had connections with my mom be reflective of those things. So the caregivers were the role model of that because I hired for that, and then I saw that and coached that. Now others are a little tougher, like doctors. I didn't expect them to be, fun loving. They were doctors, but they had at least pay attention to her and care about my mom. So if they once in a while I'd see a doctor that because my mom lost her speech and she had Alzheimer's, they ignored her completely and they talked to me about things. And I would ask them, I said, okay, go talk to my mom or pay attention to her. Some of them would do it. Some of them would look at me like I'd lost my mind. Why are you telling me anything? You're not a doctor. Yeah. So, but anyway, that was important and then some of the doctors, would even though my mom couldn't talk, they would look at her and they say, "Oh, I like your dress," or "I like this," and just pay attention to her. And she knew when they were paying. She knew when somebody was ignoring her, she didn't look happy, and so I didn't like that. So as a care leader, I thought everybody who had a connection with my mom, whether it's a physical therapist, speech therapy, somebody coming to the house to cut her hair, they all had to be fun and loving and caring. And if they weren't, they were fired. So I looked at my leadership role as as kind of managing that environment for her, and I think it made her happier for sure and safer because I looked at every day as okay, is this safe? Is that safe? Is that So those two things were critical for the kind of surround sound environment, of fun and love and safety. So
Yeah. Well, I think that's really important, and I think that, well, obviously you love her as a son, but just recognizing that, especially when people lose their speech, we ignore them, and you do see many cases of people, you know, unfortunately in facilities where they're just slumped over and people aren't paying attention, and I think that's, there's a film called Alive Inside, which you probably have seen, but it's just that, yeah, yes, they have dementia, but they're alive. They have emotions. They respond to things. They respond to colors. They respond to touch. So I think it's important to recognize they're still here and we're here with them. And I think that's at one point too. I thought your language was interesting because you talk about sharing the journey with them as opposed to sort of managing their journey, which I think is that you can experience it with them, and I think that's an important distinction too.
yeah, no, it's all they're there, and their personality is there, their character is there, even if they don't talk. Or sometimes some people come in these support groups, they talk about it being agitated loved one. So okay, yeah, they're a little different, but they're still there, and so you got to pay attention to them, you got to love them and share their journey with them. And to your point about colors, my mom loved art. She did an art. I brought coloring books for her to color every day. She loved it, and I think it was good for her brain because she would choose the colors. She was very good about coloring inside the adult coloring book lines and very complex, intricate drawings. She would be so good. And she was so funny. I remember one time I sat with her and I took a couple pens up and I started coloring with her. And she looked at me and she couldn't talk, but she slowly pushed my hand away. I could just hear her brain going, Mark, I love you, but you don't know how to draw. You're messing up my drawing. She was very gently pushing my hand away, come on, you're not doing this right. And then singing, music, she loved music. So yeah, your point about art, they're there, and certain things stimulate them more. My mom, again, she would. My caregivers figured that out. They're smart and really creative. They play 50s music, which my mom grew up in the 50s. She would sit there with a walker, and she would dance and shake on the walker and smile with the music. And so that means that they're there. They're just not quite what they were before, but you still have to love them and appreciate them as people. They're a little different, but they're still people.
So my mom was an artist too, and I remember when she was doing some going to an adult day program. Some of it was involving doing drawing and so forth, but she was really an accomplished artist. So I remember one time that they came to me and they said, we noticed that she was kind of agitated, when we took the drawing from her and we started putting her signature, and I was like, yeah, it's because that's not her signature. She didn't want you to put her signature on it. It wasn't yours. So yeah, they're still there, and I think that's important.
Very, very important.
And even though they're a little different, when I finished the book, Mark, I just felt like I know this is really zeroes in on what I think is one of the most difficult um, um, situations with is people with dementia. But it seemed to me as I read through it that yeah, there are some specific things, but in general, this seems like your principles of leading could apply to caregiving broadly, not just Alzheimer's.
Yeah, no, I think you're totally right. I mean, leading care, whether it's Alzheimer's or any other care, it's the same principles, the same selecting great people. Yeah, I think it's 90% applies across any caregiving kind of an experience. I mean, some of the supplements you wouldn't be the same, but everything else is very similar. Yeah. So,
Yeah, right. So, any closing thoughts? I mean, I think one thing you mentioned in the book, which I like, was that your goal was to give people hope. I like that.
yeah, totally. I mean, it's so funny because when I decided to write the book, I did a podcast for UC Irvine's Alzheimer's Center, and my director said, "You got some really amazing creative ideas. Do these podcasts to help people." So I did them, and then everybody came out of the woodwork. It's like, "Oh, you got to write a book." And so I wrote it, and I never knew anything about it, but I kept thinking about why am I doing this? And I'm doing it to give people hope and a plan and direction. And I'm so glad I did it because after the fact, I started doing some support groups, and people come into these support groups, they're hopeless. They're like devastated because there's no cure. They don't think they can do anything. And my goal of my book is yes, you can make a big difference in their lives. And when you see their happiness and their moments of joy, you're going to be happier and you're going to be more fulfilled. And that's as important as your loved one being safe and happy. And it's a win-win both for you and your loved one if you take that mindset of hope and have a plan and have direction. And my book is intended to give people hope and a direction and a roadmap so that you can live happier, they can live happier and longer, hopefully. And even though there's no cure, life is important, and you want to live it, and you want your loved one to live it as well as you can. And a lot of that's mindset and action and direction and leadership. So I knew I could provide that because I did, and I just wanted to share that with everybody. So,
Right. And on that note, how can people find the book, and how can they learn more about you?
oh, thank you. Yeah, it's so funny because as somebody a little bit older, I don't know anything about social media, so I had to hire some teenage girl to help me with social media. And literally, I just did a website. It's only been out a couple of weeks, but it's called boldcareleader.com. And if you go on that website, you're going to see lots of things, kind of some framing about the book if you want to learn a little bit more about the book before buying it. And then some of these podcasts will be on there and some other resources and tools that'll help family caregivers especially. And so, yeah, so right now the book is on Amazon. If you can get it there, you can get it on barnesandnoble.com. But if you go on my website, you'll learn more about me. I'm starting to identify ways I can be helpful to other people. Speaking at family centers or places that caregivers come together. I'm happy to kind of share some of my insights and learnings. And you can find out more about how to reach me on my website, boldcareleader.com, and more about the book. And so, yeah, I'm hoping that people take advantage of it. And my goal now, my boss after my mom passed, she said, "You want to come back to work? You're still pretty young." He said, "No, I got a new mission. I want to help families that are dealing with this." So, like Ron said, in addition to the book, I do support groups. I go to Washington. I just got back from Washington, D.C. last night, in fact, presenting to Congress some requests for research money and some other bills that the Alzheimer's Association is trying to pitch to Congress. And then I do fundraising events, and I do a lot of things because it's my new mission. My mission is to help people like your listeners to just feel better about their role. So,
And make a difference. Yeah,
make a
great.
difference, right?
Yeah, terrific.
Thank you.
Well, Mark, thanks so much for a terrific podcast. I really appreciate you coming on, and we'll have to invite you on again and
I would love it.
Mark your progress and see what we can do on a national level. So,
Oh my gosh, that's so great, Ron. I love what you're doing here. I mean, I've been on a couple of podcasts like yours, Ron, and just being out there helping listeners and providing resources is such a blessing and such an important thing that you all are doing. So I'm grateful. I think everybody should be grateful for you, Ron.
Thanks so much, Mark. Okay.